Hello everyone. The topic of our presentation is Hildegard e Peplau, the theory of interpersonal relations. We are group 5 and I am Deepika Gurung.
I'm Jessica Dor.
I'm April Rodores.
I'm Brenda Solomon.
My name is Annabeth Bravo. Hildegard Peplau was born in Reading, Pennsylvania, USA in 1909. She earned her diploma program in Pottstown, Pennsylvania in 1931. She then worked as a staff nurse in Pennsylvania and New York. She also earned her bachelor's degree in interpersonal psychology in Bennington College in 1943. In 1947, she got her master's degree in psychiatric nursing from Columbia University, was a member of the faculty of the College of Nursing at the Rutgers University between 1954 and 1974, where she created the first baccalaureate program in nursing. Her book on her conceptual framework, Interpersonal Relations in Nursing, completed in 1948 but published in 1952 because it is too revolutionary for a nurse to publish a book without a physician co-author. In 1968, she developed the interpersonal techniques, which is the crux of psychiatric nursing. Later, became a president of the American Nurses Association and an advisor of World Health Organization, and a consultant to the National Institute of Mental Health, and has served as the Army Nurse Corps. Peplau was universally regarded as the mother of the psychiatric nursing. In 1997, she received the World of Nursing's highest honor, the Christian Ryman Prize, at the International Council of Nurses Quadrennial Congress. In 1996, the American Academy of Nursing honored Peplau as Living Legend. And in 1998, the American Nurses Association inducted her into the American Nurses Association Hall of Fame. She died at the age of 89 in March 1999.
Major concepts of the theory now. The theory explains the purpose of the nursing is to help others identify their felt difficulties. Nurses should apply principles of human relations to the problems that arise at all levels of experience. Peplau's theory explains the phases of interpersonal process, roles in nursing situations, and methods for studying nursing as an interpersonal process. Nursing is therapeutic in that it is a healing art, assisting an individual who is sick or in need of health care. Nursing is an interpersonal process because it involves interaction between two or more individuals with a common goal. The attainment of the goal is achieved through the use of a series of steps following the series of patterns. The nurse and patient work together so both become mature and knowledgeable in the process. Another one is the meta-paradigm of nursing, which consists of 4 elements, and they are health, person, nursing, and environment. This theory, she defined person as a man who is an organism that lives in an unstable balance of a given system. Nursing as a significant therapeutic interpersonal process, it functions cooperatively with human processes that present health as a possible goal for individuals. And the health symbolizes movement of the personality and other ongoing human processes that directs the person toward creative, constructive, productive, and community living. And environment as the forces outside the organism and in the context of the socially approved way of living, from which vital human social processes are derived, such as norms, customs, and beliefs. Of the theory, there are 4 assumptions of the theory according to Peplau. So there are nurse and patient can interact. Peplau stresses that both the patient and the nurse mature as a result of the therapeutic interaction. Communication and interviewing skills remain fundamental nursing tools. Peplau believed that nurses must clearly understand themselves to promote their clients' growth and to avoid limiting clients' choices to those that nurses value.
For therapeutic nurse-client relationship, a professional and planned relationship between client and nurse that focuses on the client's needs, feelings, problems, and ideas. And also, nursing involves interaction between two or more individuals with a common goal, and the attainment of this goal or any of this goal is to achieve through a series of steps following a sequential pattern. And for the 4 phases of nurse-client relationship, which is the orientation phase or the client assessment, it is directed by the nurse and involves engaging the client in treatment, providing explanations and information, and answering questions. And also, the nurse and patient make introductions on this phase, beginning of therapeutic relationship, and questions are being clarified also in this phase. And the nurse and patient discuss needs, expectations, and limitations. And the plan of care is formulated. And nurse also helps to identify problems and to use available resources and services. The time limits established and agreed upon, and termination stage is also considered during this phase. And the second phase, which is the identification phase or the nursing diagnosis and planning, it begins when the client works interdependently with the nurse, expresses feelings, and begins to feel stronger. And the client, in partnership with the nurse, identifies problems. The nurse and client clarifies each other's perceptions and expectation. Hence, the client will learn how to make use of the nurse-client relationship. Nurse will establish a trusting relationship, selection of appropriate professional assistance, and the patient begins to have a feeling of belonging and a capability of dealing with the problem, which decreases the feelings of helplessness and hopelessness.
In exploitation phase, which is also the implementation, the client makes full use of the services offered. Client takes full advantage of all available services, and their usage are based upon the needs and the interest of the client. Client starts to feel like an integral part of the helping environment and starts to take control of the situation by using the help available from the services offered. It also begins to develop responsibility and becomes more independent. Client develops an inner strength that allows them to face new challenges. According to Peplau, as cited by Gibran, exploiting what a situation offers give rise to new differentiations of the problem and to the development and improvement of skill in interpersonal relations. And the last one is the resolution phase, which is the client evaluation. The client no longer needs professional services and gives up dependent behavior. And in this phase, the relationship ends. It is also the termination of professional relationship. The client needs to have already been met by the collaborative effect of client and nurse. Now they need to terminate their therapeutic relationship and dissolve the links between them. Sometimes may be difficult for both as psychological dependence persists. The client drifts away and breaks bond with nurse, and healthier emotional balance is demonstrated and both becomes mature individuals. And now we're going to present our case scenario. Mrs. X, a 60-year-old woman, presents to the emergency department after sleeping on the ice in her driveway. She reports right hip pain and inability to bear weight. She has no prior history of hip pain. She lives with her husband and performs all activities of daily living independently. Upon physical examination, the patient shows a positive lag roll test on her right hip and demonstrates pain with range of motion. The patient's right leg is flexed and shortened. The skin over the hip and thigh is intact with no abrasions, and the knees and ankle are non-tender with pain-free range of motion. The leg is also neurovascularly intact with good sensation, capillary refill, and pulses in the foot. Radiographs demonstrates a displaced subcapital femoral neck fracture of the right hip, as shown below. Upon assessment of the client on her second post-op day in surgical ward, there's no allergies, no history of previous surgeries, no previous injury, and no any other family medical history. No current medication. The physical assessments are, vital signs are normal. Normal heart sounds, normal lung sounds, normal bowel sounds, no nausea and vomiting. Complaints of pain in the surgical site, which is 7/10. And incision site dressings are clean, dry, and intact. IV site are clean, no redness or swelling. Pedal pulses and foot strength are normal.
Diagnosis? Acute pain related to fracture, soft tissue damage, muscle spasm, and surgery. Goal is to relieve pain. Assess type and location of patient's pain whenever vital signs are obtained or as needed. Acknowledge existence of pain. Inform patient of available analgesics. Record patient's baseline discomfort. Handle the affected extremity gently, supporting it with hands or pillow. Use pain-modifying strategies like modify the environment, administer prescribed analgesics as needed, encourage patient to use pain relief measures to relieve pain, evaluate patient's response to medications and other pain reduction techniques, and counsel with physicians if relief of pain is not obtained. Position for comfort and function, assist with frequent changes in position. Diagnosis, second, is impaired physical mobility related to fractured hip. Goal is to achieve pain-free, functional, stable hip. Maintain neutral positioning of hip to prevent stress at the site of fixation. Use trochanter roll, roll to the uninjured side, minimizes external rotation. Place pillows between legs when turning to prevent adduction. Instruct and assist in position changes and transfers to encourage patient's active participation. Instruct and supervise isometric, quadricep setting, and gluteal setting exercise to strengthen muscles needed for walking. In consultation with physician therapist, physical therapist, instruct and supervise progressive safe ambulation within limitations of weight bearing prescribes. Offer encouragement and support exercise regime. Instruct in and supervise safe use of ambulatory aids to prevent injury from unsafe use. Third diagnosis, risk of infection related to surgical incision. Goal, minimize asepsis. Monitor vital signs helps to identify infection. Perform aseptic dressing changes to avoid contamination by infectious organisms. Assess wound appearance and character of drainage. Red, swollen, drainage incision is indicative of infection. Assess report of pain, as pain may be due to wound hematoma which needs to be surgically evacuated. Administer prophylactic antibiotics if prescribed and observe for side effects. Third diagnosis, readiness for enhanced coping related to injury, anticipated surgery and dependence. Goal, uses effective coping mechanisms to modify stress. Encourage patient to express concerns and to discuss the possible impact of fractured hip. Verbalization helps patient deal with problems and feelings. Clarification of thoughts, feelings, promotes problem solving. Contact social services if needed, as anxiety may be related to financial or social problems. Explain anticipated treatment regime and routines to facilitate positive attitude in relation to a rehabilitation. Understanding of plan of care helps to diminish fears of the unknown. Encourage patient to participate in planning as it provides some control of self and environment. Diagnosis, risk for disturbed thought process related to stress of trauma and unfamiliar surroundings. Goal, remains oriented and participates in decision making. Assess orientation status as confusion may result from stress of fracture, unfamiliar surroundings, coexisting systemic disease, cerebral ischemia, hypoxemia, or other factors like medications. Interview family regarding patient's orientation and cognitive ability before surgery. In this case, she was oriented ×3. Give examples of procedures and plan of care simply. This promotes understanding and active participation. Encourage participation in hygiene and nutritional activities. Provide for safety. Keep light on at night. Have a call bell available, and provide prompt response to requests for assistance. Assess mental responses to medication, especially sedatives and analgesics.
And now we're talking about our client evaluation. 3 days after surgery, Mrs. X is out of bed and in a chair. She verbalizes a decrease in pain. There have been no abnormal neurovascular assessments. She is able to independently perform isometric and flexion and extension exercises in both lower extremities. Client demonstrating enthusiasm and active participation in her care. Discharge planning included referrals for home care. A home health nurse will visit, and the social worker at the hospital has ordered a trapeze for her bed, an elevated toilet set, an elevated cushion for her chair, and a walker. Theory has strengths and weaknesses. In strength, The phases provide simplicity regarding the natural progression of the nurse-patient relationship. This simplicity leads to adaptability in any nurse-patient interaction, thus providing generalizability. And in weaknesses, health promotion and maintenance were less emphasized. The theory cannot be used in a patient who doesn't have a felt need, such as with withdrawn clients.
Hello, Ms. X. My name is Brenda Solomon. I'll be your nurse today. Welcome to the orthopedic surgical unit in our hospital. So we have good doctors here, and this is our specialty. How are you feeling?
I'm not feeling really good. It's just suffering this pain, and yeah, it's just terrible pain in my hip, right hip. So yeah.
Okay. Well, we'll be taking care of that. Your surgery is booked for tomorrow.
Okay.
So nothing to eat or drink tonight.
Okay.
And we'll be coming around to take your signs and some blood work, give you some medication for pain, and then I'll come back and see how that works for you.
Okay.
Do you have any family at home that are going to be visiting?
I'm not sure if they're gonna come here. They're all busy, so yeah.
Okay. Well, visiting hours are from 8 till 8.
Okay.
So if you did need someone for the night, we do allow some visitors to stay overnight if you like.
Okay.
And we set them up with a chair that reclines and they become comfortable
Okay. Thank you.
if you need that support. And I'll be talking to you later then.
Okay. Thank you so much.
Hello, Ms. X. Good to see you again. How are you feeling?
Hello. I'm feeling better now. Yeah. Just the pain.
The pain?
Yeah.
Okay. Well, your ordered medication is every 4 hours. I think it's been about 3 hours, so
Okay.
we will give it to you on time before the pain gets any worse, and it'll work better.
Okay.
And that goes as far as at home too. If you start to feel the pain come on and it's time to take it, the 4 hours have passed, it's better to take it right away before it gets worse.
Yeah, good to know.
Okay, so there are a lot of things to consider when you go home. So for your mobility and getting back to your normal walking, you'll have physio appointments to come to.
Okay.
And there's a pool, and you'll be able to exercise in the pool, and they will help you get back to your normal walking.
Oh, wow.
And before you go home, I'll arrange for a dietitian to come see you, because there is a diet that's, you should have extra protein at this time, and maybe extra fluids to help prevent infection. That's keeping the body cleansed for the fluids.
Yeah.
And okay, your medication is due in an hour, so I will bring it on time. It's best to take it before it gets worse.
Oh, yeah, that would be great. Okay.
We went over the equipment for when you go home, like the walker and raised toilet seat and those things, so I think you felt comfortable with that when I was here. You will be coming for physiotherapy 3 times a week, and that will help you get back on your feet to normal.
Okay. Yeah, thank
You will see a dietitian to talk to you about a high protein diet and helps with your muscle repair.
Oh,
Yeah, you can go over them, and I will be back, and we will discuss them and answer any questions that you might have. And it's been very, very good working with you. Nice to know you.
We were assigned Peplau's theory of interpersonal relations. Peplau conceptualized clear sets of nurses' roles that can be used by each and every nurses with their practice. It implies that a nurse duty is not just to care, but the profession encompasses every activity that may affect the care of the patient. Highly applicable with the care of psychiatric patients, considering Peplau's background. It can also be applied to any person capable and has a will to communicate. The phases of the therapeutic nurse-client are highly comparable to the nursing process, making it vastly applicable. Assessment coincides with the orientation phase, nursing diagnosis and planning with identification phase, implementation with exploitation, and lastly, evaluation with the resolution phase. However, the ideas of a nurse-client interaction is limited with those individuals that are incapable of conversing, specifically those who are unconscious.
Hello, thank you for viewing our video on Hildegard Peplau's interpersonal relationship theory.